Hi, everyone. I'm Erica, the Community Marketing Associate for Springer Publishing Company. Thank you for joining us today for this Nurses Week workshop, which will help give you the confidence to certify and take the next step in your career. The workshop will be presented by Karen Myrick, who is an associate professor at the University of St. Joseph in Connecticut, and the track coordinator for the Postmaster Certificate Program in Orthopedics and Sports Medicine. Dr. Myrick is also a clinical associate professor of medical sciences at Quinnipiac University, while maintaining a clinical practice as an NP and an active scholarly agenda. She's also the editor of Orthopedic Nurse Certification Review, a new addition to our exam prep resources coming this October. This workshop will be recorded and you'll be able to view it again in a couple of days at springerpub.com/videos. Please feel free to ask any questions in the Q&A section. Hi, Dr. Myrick. Thank you for joining us today. Can you tell us a little bit about yourself and your experience with certifications?
Absolutely. Thank you so much for having me, and thank you everyone for taking the time to attend this webinar. As nurses, everything that you do is so important, and I know that your time is valuable, so thank you so much for spending some time with us today. Just a little bit about myself. I think Erica did a great job of introducing me. I do love to practice, and I love to teach, and I love to do research. So I kind of have a little bit of an agenda that goes in a circle. Some of that has really needed to include certification. And so I have some experience myself in getting different certifications. I have the ANP certification, which is the Adult Nurse Practitioner, and that was the first one I got. And after I got that one, my job was in the emergency department where they did see children. So I needed to get the family nurse practitioner certification. A little additional education, a little more preparation, another exam, and sure enough. And then a lot later, I'm not going to put a timeline on that, but a lot later in my career, I decided to become a specialist in orthopedics. And to do that, I ended up getting the orthopedic nurse practitioner certification. So I have a little experience in getting certifications myself.
Awesome, thanks. How did each of those certifications create opportunity for you?
And so each and every certification that I obtained did advance my career in some way. And in some of the biggest ways was, I mentioned it briefly, but when I first graduated from my nurse practitioner program, is I had my adult nurse practitioner. That was the degree I sat for in certification. So as an adult nurse practitioner, I wasn't allowed to see children, or I wasn't, board certified to see children. I really enjoyed working in the emergency department, and in this particular ER, we didn't have a pediatric ER nearby. So we saw, all ages from newborn all the way to senescence. And so in this capacity, they said to me, we really want to have you continue working here, but you need to get your family nurse practitioner within 2 years. So I sought out a postmaster's program, and I was able to take that program and then obtain the education to allow me to sit for the certification. So I then sat for the family certification. And that really gave me the opportunity to work in the ER, which was my passion at the time. I really found out, though, working in the ER, it was difficult. I enjoyed all of the specialties. I enjoyed literally seeing all the eye cases come in. Some of the plastic surgery cases, it really helped me to become a good suturer. But what I really found a passion for was the orthopedic cases. I would basically seek out any of the fractures or dislocations and really almost fight my way to put them back into place, because I just found it enjoyable. And I know that sounds a little bit weird. However, it was something I enjoyed the most. And I really liked to see the athletes. So in that capacity, I needed to really prove myself. I wanted to be nurse strong, and I wanted to show that I had the ability, I had the specialty, I had the expertise to be in that specialty field of orthopedics. And so I took the orthopedic nurse practitioner certification, and with that certification, I was able to demonstrate that I was a powerful, person in the field. I was able to be a provider in that specialty area with a certification that was kind of demonstrating that and proving that I had that expertise and that knowledge.
Yeah, so in that situation, I guess, how did you advocate for yourself in that difficult position?
So it's a good question. You know, in the field of orthopedics in particular, it happens to be a little bit more male strong. There's a lot more orthopedic surgeons, orthopedic PAs. There's not as many nurses as there are, just a little bit outnumbered in that case. And so obtaining the certification, it made people ask about it, which is great. Oh, I knew you could get a certification for whatever, emergency department, palliative care. And then they started to ask questions. I didn't know there was an orthopedic certification for nurse practitioners. I said, well, yes, as a matter of fact, there is, and I have it. So I was able to leverage one position simply by saying I had that certification. It also has allowed me to be able to open up a new program where I teach at the University of St. Joseph for a postmaster's certificate in orthopedics and sports medicine. It's been so much fun to teach that. So I really advocated for not only myself, but also for the profession of nursing to be able to demonstrate that, yes, we are expert clinicians, but we can also have specialty area niches, not just in overall primary care. So I was able to advocate quite a bit for myself with that certification.
That's amazing. Did certifying help you reach your goals both professionally and personally?
So yeah, I absolutely think that when you start off in nursing, there's so many directions to go in. It's really awe-inspiring that you could work in an insurance company, you could work in the hospital, you can work in an outpatient setting. And I do tell this to my students too, is as you're going along that path, you're not really sure where you're going to end up. I started as a labor and delivery nurse, loved it, was my passion. But then as a nurse practitioner, I would have been moved to the outpatient clinic. And so that really wasn't my passion at the time. How I went from there to the ER is a little tricky, but professionally, by having to follow that route of the adult nurse practitioner to family and getting that certification, it really did help to guide me and to make me feel fulfilled. And then of course, getting the final certification, well, I say final, but who knows, could be something else down the road. In orthopedics, I was able to really feel fulfilled and to be able to say that I had this, not only a family nurse practitioner, but I have this specialty as well. So when I see patients, I say to them, I also am certified as an orthopedic nurse practitioner. And sometimes that gets them asking questions, makes them feel a little more comfortable. And then personally and professionally, you know, you're able to kind of sit back and say, I've reached that highest potential that I can and gotten all the certifications that I can to kind of demonstrate that and advance the profession.
Awesome. So I know certifying is a lot. So how do you balance everything you're doing while certifying?
So great question, Erica. And so what I think, all of us, right? Nurses are busy people. We're busy in our shift. We're busy in our lives. We're busy in our education. And so you have to find some balance somewhere. One way that I personally think that I find that is I am able to be able to have synergy. So when I'm teaching something, I am able to also research that. When I'm researching something, I'm able to put it into practice. And so I think finding synergy is a really important way to be productive. That productivity can lead to certification. If you decide that certification is a priority for you, it is something you want to do, you may need to, it may help you in advancing your career professionally or getting a raise or in magnet status or whatever that might be. But if it is a priority, then you just have to have a to-do list. That to-do list will change every day and you'll go on that path to certification. How can you do that? 15 minutes here. I'm going to study this area. Next 15 minutes here, and set a date. You know, you set that date on the calendar. Everybody has had some goal that they have that date on the calendar, whether it's a race, whether it's a graduation. and then you work towards that goal. So I think that's one of the most important things to do, and to just find that balance. And it is a lot, but when you find something is important to you, you suddenly find time for it.
Any closing thoughts you want to touch upon?
Well, I think, being an advocate for your profession, I think that it is really important to be able to demonstrate proficiency, right? To make patients feel more comfortable, to make those who might be your employers more comfortable, maybe again, to advance in the career ladder, to advance in the profession, to demonstrate that something is important. I teach in a primary care nurse practitioner program, so I'm primarily teaching most of what is seen in primary care. About 85% happens to be a specialty, and that's orthopedics. There's other specialties, so cardiology. There's certain things that nurses are doing in a specialty area. If we look at our colleagues, they have specialty certifications as well. And so it's important for us as a profession in nursing to be able to say, hey, I am also able to get this, certification, and to be able to be much stronger in my expertise, and to demonstrate that with a specialty certification.
Amazing, thank you.
Of course.
We're going to open up to questions now.
Sure.
We have some in the Q&A section, and it says, did you get a raise for certifying, which you touched upon a little bit?
Yeah, that's a wonderful question. So I think it really does depend on where you work and who you work for. Most people do have a certification bonus in their structure. It is also something most of us have to sit with our, supervisors, and we have to set goals. We have to set our, usually 1 year, 3 year, 5 year goals. And sometimes we're able to bargain and say that certification is one of my goals. And is there any chance that I might be able to either have the exam paid for, have some time to prepare for that, specialty. Some people may be able to advance on the clinical ladder system, and they may have to get certification in order to demonstrate that. But there are many places, and there's also always room for bargaining for specialty certification. I say, why not?
Yeah, and it's funny, the next question is, did your employer support you when you got certified? And did they pay for the exam or study materials?
So that's a good question. Not necessarily, but it did open opportunities for me to, be able to write a book for Springer. I mean, how do you write a book unless you're specialty certified? You don't really want to do that. You want to be able to say that you have the expertise that you're writing about. So I think that in this case, my employer didn't necessarily, support it as much as they were thrilled. And now they're actually encouraging more people to get it, because it looks very good that they can say in advertising, they can say in patient responses, well, 50%, 60% of our providers are actually specialty certified. So it sounds very good, and it is very good, because the education that you get and that you can prove through certification does make us stronger.
Yeah. Another question, how do you keep up with maintaining all of those certifications?
That is a good question. What's a little bit frustrating for me is my adult nurse practitioner is on the year 5, so 5, 10, 15, and the family is on, after that. So it's the year after. So, 16, 21. So I think that there is some benefit to doing many things, such as teaching, such as taking students and precepting, writing journal articles. All of these things count towards your certification and recertification. As lifelong learners in nursing, I think most of the time we're actually actively engaging in webinars, and we're getting, the pharmacology hours in. So I think that those things all help you to keep up with the certification. And if it's your specialty area, you're likely writing in that area for a journal or for a book. You're likely seeing patients in that area. So there's different different qualifications and needs for each and every certification. So keeping up is definitely not easy, but it's fun and it's important too. So I think it's, and again, sometimes like the adult and the family, there's definitely synergy there. The contact hours count towards both. So it's good.
Yeah, you say important, and the next question said, can you talk more about holding multiple certifications really benefited you? Like, was it worth it in the long run?
Yeah. And that's a very good question. And I think that if I only had the adult, I'd be in a little bit of trouble right now, because where I work clinically in the orthopedic urgent care, we also see patients. So not only for that first job was it a necessity, you know, they said you must have this because we do see pediatric patients, but now I like seeing they're some of the funnest patients. You know, they get better very quickly, and they certainly sprain ankles and break wrists and etc. So I think that if I just had the one certification, especially adult in that case, then I would be in a little bit of trouble. As most of you probably know, things have changed, and there's the now adult geriatric and then family. So I could have been adult geriatric and I'd be okay on that side of the age group, but then I wouldn't be able to see. So I probably would not have the job that I have in the orthopedic urgent care because I wouldn't be qualified. And then also having, you know, being able to teach in a program that is for orthopedics and sports medicine, you know, I think I need that certification as well to have any credibility nationally for anybody who wants to come into the program. So I do think it's benefited me significantly.
Awesome. Another question is, are there specific certifications that are more attractive for potential employment at a magnet hospital?
That's a good question. You guys have wonderful questions, which does not surprise me. You know, a bunch of nurses and Nurses Strong webinar. So great question. So there are specific certifications that they're looking for in magnet hospitals. Sometimes you need to ask in that area. I'll tell you what is really attractive is palliative care, because that is something that's kind of up and coming. And I think people are looking for that. If you are working as, you know, an orthopedic nurse, so if you're working in an institute like a bone and joint institute or a musculoskeletal institute, they do look, if they're going for magnet status, for nurses in those specialty areas to actually hold certification. So those specialty areas, cardiology, emergency department, those are all really important areas for folks to get a specialty certification. They actually seek that out. So I guess it depends on what type of hospital setting you're in, where it is, you know, if you have a trauma center. So it really depends, but every certification is actually looked at for magnet status.
Awesome. What opportunities are there for nurses who certify in ortho?
So in orthopedics, there are specialty places such as the one that I work in. So it's an orthopedic urgent care where all the patients that come in are actually, like if you come in with a sore throat, we don't see that. And so there's opportunity to work in a place like that. Now, some people say, oh my goodness, urgent care, there's no way, I don't like that kind of thing. So then there's inpatient orthopedics. And in the inpatient setting, oftentimes they're looking for somebody who's either going to do clearance before a total joint surgery, somebody who's going to work in the operating room. They can usually look for that RN FA or the RN first assist as well. And then there's other areas such as the floor, patients that are in traction, and then the short-term rehab facilities where they actually have, some of them are dedicated for, you know, total joint patients and short-term rehab from orthopedic injuries or conditions. There's lots of opportunity.
Awesome. What are the tips best to prepare for certifying?
So I struggled quite a bit initially trying to figure out how to fit this in, especially the latest one. I think it's extremely important to have that date set and then to kind of back yourself up on that timeline and figure out how you're going to get there. And so one of the most important things to do is to find a very good resource, right? So you really want to find, practice questions. How many can you take and how can you do that the very best? You really want to be able to find, a book that's going to be a review. There's ways to figure out, am I very strong in this area and very weak in this area? And if you find out you're very strong, you're acing all the questions in a specific area, then you can kind of back it up and you can spend a lot more time in that area that you need some work. And so I think finding, any certification book that's going to prepare you, finding any online tools and things, especially that are electronic and portable, are going to be very helpful.
Great. So that actually brings us to one of our tools, our resources, Exam Prep Connect, which I will turn over to Scott to discuss a little bit further.
Yeah, thank you so much, Erica. This conversation is really great. As the marketing manager for all of Springer's exam prep products, this is the type of conversation that is really, really important, because even though nursing and getting certified is there's so much out there and there's such variation, a lot of times students find themselves in the same situation where it's very, very hard sometimes to know where to start, or, as we've kind of discussed, it's hard to have maybe confidence that you can overcome some of these challenges around planning, around your schedule or your job. There's a lot of material. There's a lot of things to memorize. And what a tool like Exam Prep Connect can do, or a digital tool where, as we were kind of discussing, you can practice more questions. You start with your exam date and kind of back into that, create a schedule around what you're able to do and maybe how long you can study per day or per week. And it really breaks up that list of those obstacles into something that's very attainable and very digestible. So you go from maybe this feeling of, I'm not so confident, I'm not so sure, to, I just took 10 questions on this topic. I got my score back. I know that I'm doing a really good job. I'm ready for the next thing. And at the end of the day, certifications are just a way for you to show your employer or show your colleagues that you're really good at what you do. So using a tool that can help reinforce those types of things is going to really, really help you at when the time comes for you to sit for your exam. So yeah, it's definitely important to introduce Exam Prep Connect and these digital tools, which can help you kind of break apart where you're struggling and understand where you're succeeding. And at the end of the day, hopefully, it'll take you to that next step and get you certified.
Thanks. So thank you, Karen, and thank you, Scott. We hope you enjoyed the workshop and have some inspiration to further your career. And happy Nurses Week. So thank you for joining.
Happy Nurses Week.